Grab yourself a cuppa, we're going for another 2-minute tip in the 30-day challenge. And in today's video, we're going to talk about aquatherapy, hydrotherapy, or exercise in water. It's generally pretty well promoted if you have osteoarthritis, and a lot of people rave about it. But for me, there are a few fundamental drawbacks to doing that in isolation of other exercise. And we're going to talk about why in today's video. So let's start with the positives. Well, basically any exercise is good exercise. So if you're swimming, if you're doing exercise in the water, it's a good idea. Your joints tend to respond well to movement, motion, and swimming can be a very good way of doing this. There's that old age adage of when you swim, you work every muscle in your body, and that's probably true as well. So from that point of view, it is a good idea. And lastly, if you are in a warm pool or you're having proper hydrotherapy in a heated pool, then the heat from the water could well help from a pain modulation point of view and maybe give you some short-term pain relief. Now on to the slight drawback of exercising in water. As soon as you get into a swimming pool or a hydrotherapy pool, the water offloads your joint. So for a lot of you, it might be easier, it will be easier to exercise in water, but it's not that functional unless you live in a swimming pool and you don't do anything on land during the day, which is highly unlikely. Your rehabilitation program needs to replicate, it needs to mimic the movement patterns, the weight, the load that is going through your joint, the movements that you want to be able to do day to day easier. Things like getting out of a chair, things like going up the stairs, getting in and out of a car and walking. Your affected joint needs to be able to tolerate all of those things with your body weight. And by taking the load or the weight off your joint, you're not really making the exercise that functional. So my advice would be, if it's something you enjoy, which for many people it will be, incorporate it as part of your rehabilitation or your exercise going forwards, but it shouldn't be done instead of a land-based exercise program. If you have any questions about today's video, then please do pop a question under the video and I'll do my best to help you out. And if you've enjoyed it, consider giving us a thumbs up to show your appreciation and subscribe to the channel so you don't miss any more of our osteoarthritis help. Thanks for watching and I'll see you in the next one.